Welcome, everyone. We're just giving everybody a chance to come into the room here, and then we'll begin our program. Okay, great. Welcome, everyone, to William James College, to our series about military and veteran populations. Today, I'm Jenny D'Olympia. I'm the director for the Military Veteran Psychology and Trained Vets to Treat Vets program. I'm also a veteran of the United States Air Force and the Air Force Reserves. And my husband is also, actually, he's about to retire from the Air National Guard. He was also active duty. So I have a military family of my own. And today, that's what we're going to be talking about. Over the past 20 years, wars in Iraq, Afghanistan, Syria, and the global war on terror have placed great demands on the United States military. When military service members are deployed or separated, military children and families face multiple challenges. In order to respond more effectively to the needs of our military families, it's essential that mental health clinicians have a better understanding of the challenges they face throughout deployment and the separation phases. A greater understanding will enable us to be mindful of the unique characteristics and challenges they endure as we offer treatment, intervention, and support to our veterans, service members, and their families. Today's presentation will be brought to you by Dr. David Haddad. He's a psychologist, consultant, professor, and the coordinator for the counseling department's military and veteran psychology program. His roles combine his interest in meditation and mindfulness practice with skills in appreciative inquiry to facilitate work with organizations that support and enhance positive relationships, high team engagement, meaningful work, and expectations for achievement. In over 30 years of practice, Dr. Haddad has helped clients to identify and maximize their individual strengths and resources. He is the co-founder of Appreciative Action, a consulting practice focusing on strengthening the capacity of organizations interested in creating a healthier and more prosperous world community. His work focuses on helping individuals, leaders, and communities further personal and organizational goals through self-reflection, leadership development, team building, program evaluation, and training. He consults to healthcare agencies, community mental health, higher education, and non-governmental organizations. Dr. Haddad is a member of the International Positive Psychology Association, as well as a member of as well as an approved supervisor for the American Association of Marriage and Family Therapy and a member of the Taos Institute. Dr. Haddad is also a veteran and worked with Vietnam veterans in the precursor to today's vet centers. If you have any questions throughout the program, please post them in the chat and we will address them as we are able. We will also have a question and answer period at the end of today's presentation. Dr. Haddad, thanks very much for bringing this to us today.
My pleasure. So I'm going to share my screen so we can start the project. So let's see here. Look at this. Okay, hoping you can all see my screens. Yes? Jenny, can you see the screen? Okay, very good. Thank you. So thanks for the introduction, Dr. D'Olympia. But I think that the number one, I think, quality that I bring is being a veteran myself, and I guess having the wonderful experience to be able to work with our veterans in our program.
My screen is black.
It went to black.
My screen is black.
My screen is black as well.
Well, that's not good.
Sorry.
Let's try
It
this
was
one
there.
more time.
Yeah, it was up and then it went black.
Okay. How's that?
There it is. It's there now. Yeah.
Okay, thank you. Okay, we're back.
Thanks.
All right.
So as I was saying, I think that my interest has really been sparked by my work with the veterans and the civilians who are interested in working with the military and veterans couples and families at William James. And each week we meet in what we describe as an experiential group where we talk about, we go in the direction of what students are interested in. And we often are talking about deployment trauma, and more specifically, we're talking about, well, how should I think about this? That how do I approach, given the multiple theories that we study, that how should we approach this? So this morning, what I hope to talk about is what I think about as an integrative and a pragmatic approach to working with deployment trauma in couples and families. And I realize that I'm using the term co-parenting to describe parents that are together. However, I am aware that when we think about co-parenting, it often is used to describe parents who are separated and divorced and still managing co-parenting relationships. So just, it's not going to be news to any of you, I'm sure, that are working with veterans when I say that just the whole idea of deployment, that military families kind of deal with a variety of stressors, and just the very idea of deployment, from the very time they're notified of being deployed, the cycle begins to increase, and that begins to signal that kind of readiness. And during that readiness period, that families are beginning to kind of gear up with the challenges associated with that. We know from research that when someone is deployed, both parents are likely to worry about safety and well-being of their families. And during the wartime, this can include PTSD as well as other kind of traumas. We know from studies in the Vietnam War and in the Afghan and Iraqi wars that that people are more likely who suffer from PTSD. They're more than 3 times as likely to experience a divorce or multiple divorce. A 2016 RAND study reported that that caregivers of children whose parents are deployed report higher levels of dysregulation and depressive symptoms than the general population. So for all that reason, it seems to me one of the big questions that we're kind of all wondering about and that we talk about is how do we integrate that? And this morning, what I'm going to talk about is a combination of things: family as systems, and combining with that behavioral couples, neurobiology, and positive psychology is just kind of a way that we might sort of think about and apply some of these ideas in our work with couples. And I realize that there is no one approach to working with couples and families. And if there was, we'd all be doing it. And so this is really an opportunity to be, I think, kind of thinking about what might be your own go-to approach to working with families and couples. So I think that the number one question that many of our students face, and I certainly am aware that I face when I sort of walk in and dealing with a couple and family, is, well, where am I and where am I going? And that's not such an unusual one, we think, from the systems perspective, because kind of I imagine that my clients sitting in front of me are asking that same question: where am I and where am I going? And so the question in some ways invites us to think about, well, how is it that we assess where couples and families are? And then how do we take them from where we are, where they are, and where they want to go? So defining that in an operational or pragmatic way is incredibly useful. So you might even just take a moment, as I said, just to think about your own theoretical model as you think about kind of post-deployment trauma. So the first kind of model, I think, overarching model that I'd like to kind of speak about is family as a living system. That family, the system, is self-regulating kind of process, constantly receiving feedback from the external environment, from the members of the system, and that the system is rule governed. There are certain things that people can talk about. There are certain things that people can't talk about. The system defines what is considered how to respond to certain kind of nonverbal cues, what's okay to name, and that there is also a multi-generational history. So if we think about if you're doing family genograms, that becomes a visual representation of the history of the system, that what each generation kind of contributes to what we're dealing with in the room. We know that there are developmental stages in families as a system, and just as families go through stages, then systems are going through stages as well. And from the systems perspective, we're kind of looking at it from kind of a circular versus linear. So as opposed to starting at 0 and the goal is to kind of get to the end, we're really thinking of it as circular. We can begin anywhere and that would lead to change that would ripple around the entire system. So just as a kind of one way of thinking about that, we can think of different kinds of systems types. And just for the purpose of our discussion, and this would be kind of on two extreme ends, we can think of a closed system, or we can think about an open system. And when I think about, and neither one of these are pejorative, they just kind of explain the way a system kind of organizes itself. So closed systems are hierarchical. Information tends to flow from the top to the bottom as opposed to the bottom to the top. I was raised in a closed system, so it would be less likely for my family to be sitting around the dinner table and for my parents to kind of ask my opinion on certain things, particularly when I was younger. But an open system is, we think about as democracy in action. So everybody has a voice, and so everybody's voice is taken into consideration. And so you can see how just those different types of family systems would lead to different ways and different ways that people can talk about and then negotiate challenges in their lives. And then finally, the process content idea that in systems theory, we realize that even though we talk about content, ultimately we're interested in process, how it is that families kind of demonstrate these rules, and they demonstrate the rules in the process of how they talk to each other and how they don't talk to each other. So by way of illustration, I want to share with you a genogram here that was from a client family that I worked with very early in my career. And this was John and Kay. John was served in the Vietnam War, and he was 19 years old when he was drafted. That I saw them when his son was 13 years old. So he had been discharged from the military and probably out of the military for about kind of 8 years at the time. The presenting issue was the conflict between John and his son. But I share the genogram here as I'm just gathering the family history. And I hope you can see, those of you that use genogram, what we see is the conflict here between John and Skip. But really, we see that John's own history, John had this incredible conflict between his father and with his stepmother. His mother had been deceased. And so John had joined the military soon after his father, when his mother died and his father was remarried. And we see on the other side here, we see that John's wife, this line here indicates kind of a lack of communication between the two of them. And over here that his wife also had conflict between her siblings and her mother. So we can see that there's a lot of kind of conflict just in the system here, and that their inability to kind of talk to each other, John and Kay, led to Skip, if you will, being kind of caught in the middle. So without even doing anything else, just having that sort of family genogram provides us with a lens for just being able to consider how the family is organized. So when they were talking about things in the office, they very quickly would fall into a very familiar pattern where, in this case, Kay and their son would in some ways be kind of joined together against John. And so clearly the challenge was to be able to have John and Kay kind of more united together. And at the time, we weren't thinking about kind of post-deployment kind of trauma. Certainly we were talking a lot about sort of the trauma of how the individual kind of integrated their experience in combat trauma. But we could see the precursors of, with John and Kay experiencing the stress of his trauma, that their ability to kind of process their own issues was really challenging. And that led to it kind of rippling out and spilling out over into their relationship with John and his children and his son specifically. And also that perpetuated the conflict between he and his wife. So in order to do that, to be able to use the genogram, we have to kind of see process. And so this comes from the work of David Cantor, who talked about process in this way. He defined that by watching who talks to whom, he used these what he called psychopolitical positions, which is in any communication, one can take what David Cantor described as one of four positions. You can be a mover. That's the person who initiates an action. And that could be talking about, I want to talk about our son. You could be an opposer where the initial reaction is to block it and say, no, I don't want to talk about it at all. Or you could be, and usually the opposer, just by to think about this, there's a mover and the opposer kind of opposes, but then becomes a mover themselves. They say, no, I don't want to talk about that. I want to talk about this. So that creates that kind of conflict where now they're kind of arguing about, we have two movers that are kind of colliding. So a person could also be a follower that makes a move to support an opposer. And you can see that being able to be a good follower is a really useful couple strategy. That to be able to know when to follow and when to move is something that couples have to negotiate. If we can't do that, then we're often having those kind of couple clashes. And then finally, we have kind of what might be described as a bystander or a witness. Those are people in families who aren't talking, but they're witnessing a lot of information. And so they're silenced by virtue of the way the family is organized. So they become incredibly useful, rich people, rich observers who have lots of information about the family if given the opportunity to be able to kind of speak. So as family therapists, we can use the bystander, if you will, to be able to kind of gather information that they hadn't previously been able to talk about. And Cantor offers one more kind of explanation, which I think is useful, which is he talks about domains that people feel comfortable talking about, that people use the language of affect, that as some families kind of use the language of intimacy. So certainly we think about an open family where everybody has a voice, they're much more interested in they're much more connected to each other in that way. In closed family, it's more about getting things done, getting the job done. And if you're not doing what people expect you to do, then there's a certain pressure that the family puts on you. And then finally, there's another domain of meaning where these are the families that are talking about kind of worldviews and sense of right or wrong. So what I find useful about these domains is that we think about two individuals coming together. It's really not just two individuals, but it's two family histories. And so how do couples, when we see them in the office, when we see them as a families, how do they come to this choice that they're organized in a particular way? That my experience is that many families don't overtly negotiate that. It's sort of, you fall into that. And it's only when there's a challenge that you begin to see where it breaks down. So that's from a systems lens, it's useful. We expect that when there's a challenge, that's the opportunity when change gets a chance to happen, that people have an opportunity to see what's working and what's not working, and then to negotiate that. So from the family systems lens, we also know that it's not only that individuals are developing, that the couple and the family is also going through stages of development, which kind of shapes how the system is being organized. And that used to be thought that it was just individuals that went through kind of these changes. And I put them side by side just for the purposes of our conversation here. So we in traditional psychodynamic theory, we thought of birth to 5 as being those kind of key developmental ideas, but clearly people began to recognize, developmental theorists, that people are growing and changing through many stages. But in the couple system, we think that the individuals come together as couples. So during that period, and no systems go through that in a kind of perfectly sequential way, but I'm using this as a way of kind of describing that. So couples come together, they have a chance to, if you will, figure out if this is the relationship for them. They spend some time negotiating, then they decide they can make a commitment, and now they're kind of united with the idea of being a couple. And so once they make a commitment, then for many couples, they might lead to children, and then child wanting, and then the mid-years. And each of those stages have challenges and responsibilities. And so if we parallel those with when parents are presenting, when couples are presenting with children, we can look at, well, what are the developmental challenges from birth to 18 months? What are the developmental challenges from 18 to 2 years? Because we can think about those same challenges in the system. So for example, we think about from 18 to 2 years, where the needs of that child is completely at the mercy of the parents. The parents have to be able to kind of be there and be available to them. So that really requires couples to be able to have some kind of a organizational plan to be able to provide for the needs of their children. Otherwise, there's going to be a burden on the couple. And just going back to the kind of coupling, the first stage, I want you to think about in the case that I shared with you previously, the genogram that I shared with you, that couple had gotten pregnant before they were married. And so what that means is that if we think about a couple as coming together and they have a chance to kind of date and figure out if they want to be with each other before they jump into the business of being parents, this couple had no opportunity to do that. This couple fell right into the business of parenting. And so there was none of the opportunity to do what we think about in traditional courtships. So they fell right into that. And so seeing them later in life, we might wonder, well, what did they miss out on? How did they, given that they went right from kind of dating into the business of parenting, they never had an opportunity to kind of develop some of those skills. So that's sort of speaks to the need for that couple to kind of reacquaint, if you will, with each other and get to know each other again, so they can begin to negotiate some of the challenges of parenting. So this comes from this deployment kind of grid here comes from Families Under Fire, Charles Figley's kind of book on working with military families. And I thought this was kind of really useful when thinking about working with military families. So the courtship and pregnancy often leads to, for many soldiers, deployment. In fact, that many younger soldiers who may have been dating, they may decide to kind of marry once they discover they're deployed, because that provides some security for their partners who are home without any resources. So they're deployed, and then during that deployment, the new family is born. And so they come home for a while to be able to meet their new children. And during that period, again, think about the challenges kind of adjusting to a new child or young children. So they're away, they come back, and then they're kind of dealing with that, and they have an opportunity a few days, a week, maybe 2 weeks to be able to kind of be reunited. And they have this reunion. And then there is maybe some semblance of normalcy that comes back, and then they're redeployed. And this seems particularly relevant now in this era where people, then our soldiers and Marines and sailors and airmen have been deployed multiple times. And so that cycle kind of repeats itself. So it resumes normal routines, they're redeployed, and then they are kind of dealing with challenges. And if you have families with school-age children, when parents are deployed and come back, how do parents kind of reintegrate back into the just the routine of parenting while they're away? Oftentimes, one partner has taken over a lot of the kind of responsibilities, and they've developed a routine, a necessary routine for being able to kind of manage that. And the returning partner is now kind of figuring out how to step in and how to participate. And that can be quite challenging. And for many couples, that may lead to divorce. And so with this cycle, this graphic represents is so you can be divorced, which would then be kind of looking single for a period of time, and which may lead to kind of dating again. And what the research tells us is that many soldiers who are separated or living in a military community, they often find other people who are connected to military communities. So again, I think as you'll see, the cycle sort of suggests the whole nature of deployment continues to kind of challenge families in this particular way, and particularly in the world that we live in now, where we're relying on a volunteer service, that people are being called on to be deployed multiple times. And over the course of the lifespan, those present some unique challenges. So all of this kind of suggests then that one of the goals here is for us to figure out, well, how do we engage kind of our clients when they walk into the room? So I want to suggest drawing from the work of John Gottman, which many of you might be familiar with, John Gottman's 4 Horsemen model. And so John Gottman uses the terms the 4 horsemen of the apocalypse, which is probably a fitting way to describe it: criticism, contempt, defensiveness, stonewalling. And he argues that when coming from the behavioral perspective, when these behaviors are present, then the likelihood of the couple sort of remaining together goes down, and the likelihood of their divorcing before goes up. And so he had that there's a particular ratio, a 5-to-1 ratio. And so criticism, attacking a partner's character with intent of making someone right or wrong. So if we went back to, just that, look at the couple that I shared with you in a genogram, just their genogram would suggest they had that kind of conflict. And we can see couples as they talk in our office, we can see them presenting this dynamic. Criticism, contempt is the other one. We are attacking a partner's sense of self, derogatory name calling. Defensiveness, we're seeing ourselves as a victim. Or stonewalling, where we're just kind of unwilling to talk and disengaging. And we can, again, seeing how those kind of behaviors can contribute to a particular kind of stalemate in couples. And so for Gottman, he would suggest that 5-to-1 ratio is the ideal. That, in other words, kind of 5 positive interactions to negative. But what's interesting about this model is, from the behavioral perspective, that if these behaviors are learned, then they can be unlearned. And for Gottman, the very simple act of sharing with couples the 4 horsemen becomes a great organizing metaphor. Because if couples can do nothing else but simply notice that we're doing this, ICE recognizes, it creates that moment of pause. And it's that moment of pause when a new learning is possible. Before that, couples are stuck in that pattern. So from the behavioral perspective, it makes sense that just recognizing it when it happens makes sense. And so another way to thinking about this that Gottman invites us to consider is that healthy couples are better at taking turns, at turning towards instead of turning away. So if I say to my partner, I'm really angry about something, that my partner, that the healthy couples can turn towards, where one partner might say, can we talk about that? I want to hear what it is that you have to say, versus kind of becoming defensive and kind of pushing away. So healthy couples, we're just better at being able to turn towards. So a bid is an attempt for an attention of some kind, affirmation, affection. So that turning toward becomes incredibly important. So turn towards is a way of acknowledging the bid. Turning away ignores the bid, and turning against is rejecting in an angry way. So again, we get a chance to just see in a real kind of operational way that these are behaviors that are visible, and that in my experience, what's really useful, particularly for couples and individuals that may not have be psychodynamically inclined, that it provides a real concrete tool for couples to use. That even if by just recognizing that they are in one of these patterns, and to be able to step away, provides some of that moment of relief, where couples have a chance to be able to stop and think about, how do I want to re-enter into this conversation? So Gottman sort of suggests that couple interactions are incredibly stable over time, 80%. And so that's really useful. We can see how stuck that we might get, that these interaction patterns are stable over the course of a lifetime. And this is the one that I really enjoy, that most relationship problems don't get resolved. So we think about the kind of issues that our couples bring into the room, that he would argue that most of them don't get resolved. And so the idea of spending so much time kind of fighting, if you will, and negotiating, as opposed to just simply trying to change the way couples interact with each other, not only increases connection, but increases productivity in the way of being able to kind of develop strategies for managing whatever conflicts that might emerge in a relationship. So their early research, and I think a lot of this research has been substantiated in Gottman, that couples that were stuck in those patterns, that he was able to predict with 90% accuracy those couples that would end up in divorce. 60% of couples who experience relationship satisfaction decline within the first 3 years after the birth of a child, right? And so that makes incredible sense, right? If you look at the developmental challenges of children, And along the way, so if couples aren't able to repair following the birth of a child, you can see, given this statistic here, that 80% stability over time, that couples are stuck in that pattern. And each time that the conflict emerges, another conflict emerges, we get a chance to see that same pattern emerging. And so providing couples with a way of seeing that pattern or interrupting that pattern is incredibly kind of useful. And I think couples can grasp that in a really kind of concrete way. So I hope you're beginning to see that with the Gottman model, as well as in the family systems model, that it provides an overview for therapists to be able to kind of conceptualize what's happening in the room. But as we do that we're also providing for our couples really with a way to be able to kind of step back and step out of that reactive phase and begin to kind of slow down their own reaction and to be able to be more present in their relationship. So if we think about the kind of fighting that Gottman talks about, the four horsemen, from a neurophysiological point of view, right, we know that those kind of arguments just trigger the fight or flight response. That's, that any kind of danger that our kind of brain might sense out there in the world, which can be just a criticism or a look on our partner's face, our brain doesn't sort of distinguish between whether this is someone trying to shoot us or someone or just some other kind of danger. It immediately prepares for what it perceives as danger. And so that fight or flight response increases the blood flow from our brains into our extremities, preparing us to be able to run from the danger or to be able to take action. And so there's no energy, there's no blood flow going to the brain, which increases our capacity to be able to think. And what we need at these moments clearly is the capacity to be able to think. So we think about kind of upregulation, right? That during these times of toxic arguments, that partners become flooded by all of the kind of the body's mediated change, quickened heart rate, increased perspiration, tensed muscles, release of hormones. So again, the perception is focused on threat. And you could probably see that in some of the clients that you work with and couples where you can just see them getting kind of activated. And for many couples and individuals, that's not something that they necessarily are tuned to. They go right from being triggered to action, as opposed to having any capacity to be able to mediate that. So providing couples with the kind of Gottman provides, combining Gottman with just some of this basic information about regulation, individuals are able to kind of recognize, oh, when I'm in that state, I notice that I'm feeling kind of charged. And when I get a chance to step back and I'm cued to be able to kind of focus attention on my breath, which you might think about as kind of down regulation, then we begin to experience some of the calming effects. And this is where we think about the kind of positive emotions. So if you're familiar with the work of Barbara Fredrickson, she coined this term, the broaden and build theory. And so if we think about fight or flight as one of those evolutionary responses that has continued to be present, it has to have served some evolutionary purpose. And clearly we know that it's a way of protecting us from danger. And so Barbara Fredrickson wondered in the same way, well, what good are positive emotions? If they've continued in an evolutionary sense, they must serve some purpose. And so she would argue what they serve is they provide a way for individuals to kind of expand their response repertoire. So in fight or flight, my capacity to respond is narrowed, but in broaden and build, my capacity to respond is expanded. So positive emotions, when I notice someone in my family or in my community that's kind of loving, I can see them as a safe person. So our capacity to be able to recognize safety, to be able to be connected to others is directly related to our ability to be relaxed. when we're tense, it's not possible. It's much more difficult to notice because we're kind of regulated. We're kind of evolutionary primed to be able to kind of notice when we're in that way, to notice the danger. So I might pick up on a cue from my partner of a frown or some other cue that may have nothing to do with me, but I'll interpret that as something going on with my partner. So broaden and build theory suggests that what we choose to focus on really is important, and strengths, the more that we can focus on the qualities and that we want to bring forward, and positivity, that we can bring resources into that room. So what we choose to study makes a difference. So if we, going back to working with our clients, what is it that are the qualities that we want to help our clients to be able to develop? And what are the resources that I'm trying to cultivate in the room? So what I'm trying to cultivate is translated into the room in what I'm also trying to kind of assist my clients to be able to learn, which is to be able to focus on resources that they can bring to bear in their negotiating challenges in their relationships. So in order to be able to make those changes, going back to going back to Gottman, it requires kind of large amounts of positive energy and affect. So we know that to be able to do that, Barbara Fredrickson would say that when individuals are focusing on what those activities that expand their capacity, it gives them, increases their positivity, the more they're doing those, the more they're able to bring those resources into the relationship. So it's just the kind of opposite of what we think about when couples and individuals are struggling. They often stop doing many of the things that give them joy, that connect them with the resources. They become more isolated and disconnected and maybe engage in activities that are a way to kind of get away from or deaden whatever the stresses they're experiencing. But Barbara Fredrickson's work tells us, in the research in positive psychology has shown us that when individuals are able to kind of focus on and expand those activities that give them joy and connect them with positivity, they actually bring more resources into the room. So when we think about asking questions and inquiring with our clients, we can focus on what's not working, but it's also useful to focus on when things are working. So, because no couple is always struggling, there are those moments when the absence of stress, but what we remember, what couples remember, what individuals remember is the negative. So it's a challenge to be able to help people to think about what's working in their lives. So to be able to kind of develop that language of strengths and techniques that helps couples to think about what they want more of, that comes directly from the work of Gottman. It comes from the work of positive psychology, that Gottman's work where he invites couples to think about, when they notice they're in that struggle, that someone can just simply step away and call a timeout. And during that period of timeout, they're thinking about, well, how do I want to come back into this conversation and kind of, again, readdress the very issue that was going on here. So it's less about the fight itself, and it's more about engagement. How do I engage with my partner to be able to have the kind of conversation that we need to have at this stage in our life? So developing a language of strengths and techniques that create what couples want more of, positive psychology kind of invites us and provides us with some ways to think about that. So that top-down regulation as opposed to bottom-up, where it's just purely physiological. Top-down is I'm using my higher order thinking to be able to decide what I want to do in this moment. And when I do that, I'm refocusing my attention. Top-down, I realize I see what's going on here. I'm recognizing what's going on. If I'm a couple, a partner in a relationship, I may be taking a breath. I may be kind of get up and move a bit. I may go for a walk or exercise, get out and get some fresh air. I may listen to music. I may even kind of introduce the idea of kind of presence. Am I even aware of being present in this conversation? Am I present in the room with my clients when they're kind of tense? I can use these myself as the clinician to be able to refocus my attention in this room. And some of the questions that I think that or the interventions that you might use come from positive psychology, solution-focused therapy, and I've listed a few of them here. The miracle question, which is from solution-focused therapy that many of you might know, if there was a miracle tonight, when you were sleeping, and you woke up tomorrow, and whatever the issues, the circumstance that led you to coming here were somehow magically disappeared, what would be happening that's not, what would you notice that would let you know that things had changed? So that miracle question immediately points towards the kind of where couples are going, as opposed to where they've been. So increasing gratitude. From positive psychology, we know that when people are practicing kind of gratitude, just being grateful each day, that gratitude intervention has been one of the most repeated interventions in positive psychology that has shown robust effects, 6 weeks, 6 months, and a year later, that practicing gratitude. So when couples or families are simply incorporating what they're grateful for, that becomes a resource that everybody in the family can utilize. Couples dealing with children, capitalization, which is you're capitalizing on an opportunity that just emerges in everyday life. When a child is kind of behaving in a way that you want them to, you be able to use that and turn around and identify it in a moment. If you don't name it, you can't draw on it as a resource. So to be able to underline it and think about it as a resource is a way to kind of build emotional intelligence. And that where families that maybe are less used to kind of talking about feelings, building emotional intelligence requires a language. And so sometimes in therapy, we're providing couples with that language. So success finding, again, looking for opportunities when couples and families are successful, and family rituals. From a systemic point of view, we can think about some families as under-ritualized. When families are under stress, two-parent, two working families where you're not able to kind of eat meals together, that many families have a lack of rituals at all. And I think about rituals as things like dinner time, bedtime routines, family gatherings of some kind, that over time, those have meaning in a family. And so when there's a lack of rituals, then there's a lack of meaning. So just introducing rituals can be incredibly useful, and assessing couples and families for rituals can be a really useful way for introducing this. So the last couple of things I want to talk about is kind of character strengths, which is the values and action survey. For creating a language of strengths, the values and action survey creates a language of strengths. And I've listed on the slide here on the bottom, which is the website. You're going to get a copy as a PDF here that you can go directly to this website, character strengths. Even if you Google the values and action survey, that would come up. You can take this character strengths assessment for free. Your clients can take it for free. It's translated into about 20 different languages. It's been given to about 10 million people around the world. And what it does is it immediately kind of shows people's character strengths. So 24 character strengths. This is, instead of like the DSM that measures kind of what we think about as insanities, Martin Seligman and Christopher Peterson, when they wrote this book, the Character Strengths and Virtues book, they thought of it as the manual of the sanities. All it does is measure strengths. And they argue that we all have all of these strengths, and some of them are our go-to strengths, and some of them are ones that we lose less often. So here is a kind of an example of some of the strength. And what's interesting, when I give these to couples that they look at the strength, we can see that some couples might have their most used strengths are quite different than their partner's most used strengths. But once they start recognizing that they each share kind of unique strengths, then it's a matter of, well, what strengths do we want to bring to bear in the challenges that we're facing right now? So it creates this kind of unique way of talking and thinking about kind of bringing strengths into relationships. And again, without kind of a language, it's hard to draw on these, right? So what the Christopher Peterson and Martin Seligman, in the creating of this, they creating a lexicon of strengths is a first step to being able to kind of talk about issues. If we don't have any of these languages, then what we do is we go directly to the problem as opposed to stopping and thinking about, what am I bringing to this moment? Just like the Gottman's notion of being able to recognize the 4 horsemen, or we think about kind of emotional regulation, just being able to stop and notice where my attention is gives me an opportunity to connect with kind of resources. So ultimately, all of this unlike what I'm demonstrating as I'm rushing through this in the 50 minutes that we have in our conversation, the goal is to kind of slow down, right? That there's often that tendency to kind of move quickly, or our clients get activated in the room and we might get activated. Clinical effectiveness kind of greatly depends on knowing when to slow down and when to speed up. So a focus on strength in therapy and in supervision allows us to be able to slow down and provides resources directly for our clients. So this comes from the work of What Works in Psychotherapy from Miller, Hubble, and Duncan, that their research found that exemplary therapists are found to be much more consciously mindful than less effective therapists. In fact, what they talk about is that they have there's a dropout rate of 50% that those therapists that aren't being kind of more conscious, the most effective therapists compared to least effective therapists by virtue of who drops out in therapy, there's a 50% difference between effective therapists and less effective therapists in their studies. And he said, because many therapists can't predict when clients are going to drop out because they believe that their approach is working for the clients. When many clients just simply don't come back after the first session or a couple of sessions because they feel like the therapist somehow isn't connecting to them. So, and this is their kind of What Works in Psychotherapy. This is a really kind of a useful kind of graphic that really kind of captured me. It sort of flips around the expertise of the therapist as the skill, that they argued that the number one resource in the effectiveness of therapy is what the client brings to the therapy. And they would argue 40% of what works in therapy comes from the client. And the next piece of that is the kind of the relationship and the caring and warmth that the therapist is kind of demonstrating. And so the client feels connected. And finally, it's the placebo and hope that is generated from that first sessions, that the client feels like, I feel like something could happen here. And I always think this is kind of a real interesting one, being someone who teaches therapy, that the model or the technique is only 10% of what's effective. So it almost seems like the inverse here, that why are we learning all of these techniques when only 10% of that is what kind of constitutes effectiveness? It's really because we know that there isn't just one technique that works. Ultimately, in the hands of a good therapist, they're doing all of these things. And it provides us a way for thinking about, we want to empower our clients to be able to have the resources that they need. And I think that in we think about sort of many clients who maybe are reluctant to be in therapy, this provides a real pragmatic way. So to be not in therapy, there are certain skills one needs to learn. So let's think about what resources might be useful for you to be able to, make real effective use of the therapy. So finally, kind of an emotionally charged, confiding relationship. That's the number one. So to the degree that I can create a healing situation, so client feels connected, and a rationale and a conceptual scheme that can explain what's going on. So to the degree that I can explain to my clients, this is what I'm doing when you're here, they can they can say that makes sense. So in the spirit of informed consent, they know what they're consenting to. And then finally, there's some kind of a ritual or something that we're doing in therapy that kind of reinforces what we have explained as our ritual and conceptual schema. So couples, our clients and families feel connected to the resource. We're feeling connected. And as a result of that, we can begin to be more effective with our clients. So ultimately, I guess this boils down to the first session, being able to provide a rationale for seeking regular client feedback, to be able to say, well, how are we doing? How is this sitting with you? Being able to help create a place where our clients are giving us feedback for what's working, and be able to kind of restate the rationale kind of regularly. And it also gives us an opportunity to think about where we might want to shift. And we can integrate many of these kind of different techniques, and the few that I mentioned, I might use many of those in a course of therapy, but I might use them at different times. And I would also introduce the rationale as I do that, and giving couples and families an opportunity to kind of talk about what they would find useful about it or not. So that's a good place for us to maybe stop and think about some questions.
I think we have one question here in the chat, Dr. Haddad, is Peter says your emphasis on positivity Is it, my experience is that without pain, people don't have much interest in change. What do you think?
Well, I think that's a really common one. Like when people are in pain, I think in some ways it's hard when people are kind of suffering, and in some ways, sometimes people might need need to have some medication to be able to experience that. But I think the research would say that even if we think about positivity as kind of moments of connection, and even when people are in pain, that people aren't in pain all the time. So it's not suggesting that we're discounting their pain. We're simply saying there's something else going on in your life. So if they're in therapy, that I would suggest they care about their families. They're coming because they want something. And so that would be something that I would sort of frame as something positive. And also, if I use the values and action survey with that kind of mythical client that we're describing, then that would rate them only on their strengths. And what the values and action survey and positive psychology model posits is that character strengths emerge from adversity. So going back to our clients that are suffering, the fact that they're suffering, and many of our clients may be suffering for a long time, there's something about their just capacity to kind of keep going. And here they are coming to therapy even after all of their pain. How do they do that? That there's something about their resources that they're bringing into the room. And I think judiciously using that language of strengths as opposed to kind of, forcing the square peg into the round hole. How do we get your slides? I think that they're going to send a PDF of the slides to everybody who's been signed up for the course. And then also there's a kind of a bibliography included with references to all of the resources that I've talked about in this presentation. Yeah, I saw that sort of comment from sort of Peter, dissipate the pain right away. I think you're right, Peter. I think it's not we're not trying to dissipate the pain. We're simply trying to also kind of elicit resources as people to be able to kind of manage their pain. That clearly people are doing something to do that. Yes. Okay.
Do we have any more questions? Jennifer?
Yes.
I don't. I just have just a kind of a thought for the whole thing is, first of all, I'm a USO volunteer as well and have been for 10 years. And I think what's important, especially for civilian clinicians, like clinicians that are, especially in New England, is that, again, like one of the slides said, is that our National Guard and reservists have deployed and redeployed numerous times, and the time from Vietnam to now, the reintegration is just boom, on an airplane, you're back home.
Yeah.
And so that whole dynamic is also difficult for the family systems, because again, like you said, Dr. Haddad, was that, while the person's deployed, co-parenting, it could even be a grandparent, who knows who's helping out in the family, but there's that dynamic and that change, and they're used to a certain command system or a certain level of, and so their dynamics are going to be a little different. So I just think that's important for us to remember.
Yeah, and just maybe one more thing is that people are deployed in the National Guard. They're coming back into a community that isn't necessarily a military community. So if you're deployed to the military community, everybody's going through the same thing.
Exactly, especially because like North Carolina, you've got a huge base, so everybody.
Absolutely.
Yeah, thank you.
Yeah. Okay. Well, thank you, everybody. It's always kind of a pleasure to talk with people that are doing the same kind of work. So I welcome the opportunity, and thank you all for your attention.
Yes, thanks for joining us. We can't do this without you, and we really appreciate your interest in the community. And we will be offering another discussion next month. It will be on women veterans. Thanks, everyone. Bye-bye. Thank you very much, Dr. Haddad, too, for taking your time to put this together. And give us
Thank
this
you.
information.
Thank you.